important stuff here. The FDA has identified a connection between breast implants and the development of a rare cancer. With 33 patient deaths worldwide, the company Allergan has now recalled their textured breast implants. Textured breast implants, that's the key word here. Dr. Kelly Killeen is a plastic and reconstructive surgeon with Castelleth Plastic Surgery. And this morning she's here to talk about breast implant dangers and what you need to know whether you have this specific kind or if you're thinking about getting some breast implants. Welcome, doctor. Good to have you here.
Thank you.
So first, let's start with this. This link was made years ago. Why now issue this recall? It is voluntary on behalf of Allergan, but still, why now?
Well, I think the main thing is that year after year, we've known about this association for well over 10 years, close to 20 years now. Year after year, the numbers of patients that have developed this very rare cancer have gone up. And we still at this point don't have a good understanding why patients are getting this type of cancer from this type of implant. So I think just as a precaution, as the numbers go up, we really need to stop using these implants until we have a better idea of why this is happening.
So you mentioned textured implants, and you brought some samples here, and you can tell which is textured and which is not. I heard one doctor describe this as almost like a piece of Velcro that sticks to the body tissue, and that's what causes the body to get irritated. Is that pretty accurate?
That's absolutely true. So the texturing on the implant helps hold the implant in place, which is very important for a shaped implant. Since there's an up and a down, if they rotate, they look crazy. So the texturing has an important job, but it does cause inflammation. And so a lot of the theories about why this cancer happens surround chronic inflammation around the implant. And the belief is that this texturing either provides a place for bacteria to live or that it just causes chronic mechanical irritation of the capsule itself.
And how long can that take?
So the interesting thing about this cancer is that most patients develop it very, very far out from their initial augmentation.
Okay.
So the latency to onset, meaning the time period from when you have your augmentation to this cancer shows up, is about 8 years.
Oh, wow.
So yeah, so this takes a very long period of time to develop.
Is it treatable?
It's absolutely treatable. So a majority of women that develop this type of cancer present with sudden swelling of one breast. No pain, no symptoms other than that. And if it is caught in the early stages, the treatment is just removal of the implant capsule.
So what should you do if you feel like something is wrong? How do you know something is wrong? What are the symptoms?
So the symptoms are just painless swelling for a majority of patients. So if you feel like something's wrong with your breast, something changes, you should always come in and see your plastic surgeon as soon as possible. If you're no longer in the area where your plastic surgeon practices or your plastic surgeon has retired or passed away, go follow up with any board-certified plastic surgeon to talk about your options. The key with any type of cancer is catching it early, and this cancer is no different.
So how many women are affected? Do women even know what kind of breast implant they're getting? Should they know?
I think you should know. A vast majority of women that I consult with, I do mostly revisions in breast surgery, have no idea what type of implant they have. And so we can usually determine this by contacting the companies on your behalf. So calling your original surgeon is a great idea to find out what you have. If they don't know, you can call the hospital or the surgery center where you had surgery, or you can even call the implant companies themselves. We can help you navigate this. You really should know, and you shouldn't forget, your plastic surgeon. Once you have surgery, you need to follow up on a yearly basis. These implants are not meant to be lifetime devices, even in the best circumstances. So you do have to have a plan of action for changing them out at some point.
That is good to remember. So be aware of what your body is telling you is the message here. Doctor, thank you so much for coming in. You did wonderful. This was your first time on TV.
My pleasure. Thank you very much.
Great. Thank you, and we'll be right back.